Hello, everyone, and welcome back to Mic Check
2.
My name is Rachel.
I'm Aja.
I'm Sean.
And today we are joined by the one and only, the jack of all trades. We actually just learned a lot about her off camera, but we will allow her to introduce herself.
Hello, I'm Dr. Lynn Roberts. I'm a nurse practitioner. I'm certified or recognized in diabetes and HIV, primary care and family care is kind of my specialty. So,
When did you start? What year?
in July of 2016. It's been a while.
It's been a while. You know this. What is this, Lynn's third
podcast that we didn't convince you to come on to?
She did diabetes.
I never have to be convinced to talk.
did diabetes,
And that's how we love you, Lynn.
Yeah.
But just off the record, before we dive into the topic, I just want to say we learned Lynn has about 8 degrees.
That's why we don't ask Google. We ask Lynn.
No, thank you.
We're coming to ask Lynn.
Yeah. We need to ask Lynn a folder.
A lot of them.
So that puts us into
That's
our
the new
topic
segment.
today. Yeah,
Ask Lynn. You can ask Lynn one question per day.
Hashtag ask Lynn.
And talk for an hour.
Yeah. So we want to dive into it's a serious.
Gut health. Just go ahead.
Okay, good health. Yeah,
No disclaimer. We're going to talk about gut health.
because it's important.
Your gut is very important.
A happy gut. A
I
happy.
want to see where y'all are going with that.
And let's move on.
So more specifically, we're going to talk about IBS, which is the Irritable Bowel Syndrome.
Also called small intestine bacterial overgrowth.
Oh, wow. All right.
So
that was our
SIBO in that sense.
I'm gonna learn. I know I'm gonna learn something today. Today.
So what is IBS and how does one get IBS?
Okay, so I think you kind of have to look back at it's not the same for everybody.
Okay.
It's there are different causes for it. Whether some people are lactose intolerant, but maybe going ahead and eating lactose foods. So maybe they go ahead and eat the ice cream, drink the milk, and they have a sudden onset of cramping and explosive diarrhea. And they say something is wrong with their stomach. And they know, it's usually like cramping, kind of lower. It's very uncomfortable. The reason gut health and this disorder gets your attention is it's very uncomfortable. Mm-hmm. It's not something that you're going to just like wait and take care of tomorrow. Okay, so that can be one. A lot of us, we've gotten better testing, and we know who's gluten intolerant. So some of the people with celiac disease are gluten intolerant. And there's 2 differences there. There's celiac disease where we can pluck little biopsies from the stomach and see that you have celiac disease. But some people, their test for that may not be positive, but they still don't tolerate it. So a lot of when we talk about IBS, we're talking about what do you tolerate? And then it may be that you have inflammation and all due to and stress can be a cause of that. I wouldn't say stress causes this disorder in and of itself, but you're one of those people who have a higher level of sensitivities. There's even things such as, and you'll laugh when I tell you this, abdominal migraines, because some people take their emotional feelings, thoughts, and inability to cope to
They're
the
good.
gut.
Oh, wow.
That's me.
Yeah.
So does that have to do with working
man.
too hard?
Okay.
I was trying to find a way out of work.
Remember how in
my
prior
gut.
generations they said you just need to work it out.
So it sounds like gut health is very important to have like a functional life. Would you say? Like how important is gut health?
Oh, yeah. If you're trying to work, or maybe you're talking to someone, maybe you're closing on house, maybe you're talking to someone, and you suddenly get that onset of cramping that makes you nearly bend over, and you have to find a bathroom, it does interrupt your life.
It's so funny because
You have some stories.
I have stories.
Yeah.
It's
And
very embarrassing.
if you're going down the road, it's not like you can just say, oh, I'll wait until I'm going to stop at McDonald's in an hour or 2. No, you will need to find somewhere now. And then you'll need to be afraid. They live in that fear of, are they going to embarrass and humiliate themselves? And that would be horrible. I mean, as a grown adult. So just think that you're living your life afraid that type of episode is going to happen to you throughout the day. So you see how it can get very painful.
And embarrassing, I guess.
And shame.
So I have a question. I don't know. So wait. So it's episodes. So like you can have it just because like you're under stress, maybe, like, or you had like a gluten, but doesn't mean like every day I would have to have IBS.
Let's just say take an example here. Say you don't know much about the keto diet, but you've heard your friends talk about how great it is, and you are going to try it. So you go get you some of that MCG oil, or you decide you're going to do butter coffee.
Oh.
Or maybe you're going to put some heavy cream in there. Okay? Heavy cream. Make your coffee taste great. You put it in there. You probably won't make it to work before you will experience that, because your gut is not used to that high level of fat. So when it hits it, it's going to suddenly bring all the water from the rest in there. You're going to feel that bloating and exploding, probably some cramping. You will have to find a bathroom real quick. And so things that you're not used to, that you're not tolerant, substances that you eat, your gut will respond and say, maybe I don't like this. Maybe I do.
So would that be, for instance, like I don't eat a lot of pork. So if I stick to certain type of food, like just chicken and fish, and all of a sudden I introduce my diet to pork, and I start to feel,
Probably when you come back to, and like, say my daughter, she went to really vegan for her and her
if you go like
husband
really
for a
vegan,
couple of years, and then they started saying they thought they were getting sick, so they started reintroducing some, and that was very tough. I mean, it probably took 6 months or so, and that's what makes this disorder specifically difficult, because when you're treating a patient with this, or let's just say a patient comes in, they're going to tell me, well, I got gas, or I burp all the time, or I feel bloated. Okay, it could be this, but I need you to do something like keep a food diary.
Okay.
So we can find out what you're sensitive to. And then we'll put them on what's called a FODMAP, and that's FODMAP diet. So that's going to help eliminate things like the oligosaccharides, the disaccharides, the monosaccharides, which are sugar alcohols. Okay. So those are things that we know, just like that heavy cream with that high fat may create that sudden onset of diarrhea, which is always a part of this. Probably some bloating feeling, some cramping, and you can call cramping and bloating painful. Some people would say it is, or you could leave it that way. So sometimes you'll see that the triad for this is the bloating, diarrhea, and abdominal pain. And so what we need a person to do in that type of situation is to keep a log. First take them off of those and take them on to the low FODMAP diet, and kind of read you what that is. But for one thing, it's going to be stopping dairy.
Okay.
It's going to be stopping beans, lentils, and there are certain fruits and vegetables that you need to stop. And then it should, like over, say, 4 to 6 weeks, you should notice the symptoms maybe stop. And then slowly introduce one back. And if it occurs again, that's a food you probably don't want. So that's, I think, what makes this difficult. Patients come to us for their gut problems wanting a pill.
Oh, they want a quick fix.
They want a quick fix.
They want to be able to eat that food still.
Right. And this isn't going to be about, I give you a pill, so now you can eat ice cream and milk every night and blah, blah. This is going to be you taking some responsibility to help work with us in a food diary and to find out what foods in your diet need to be eliminated. And, this is a better time in life to have this type of disorder, because years back, if you were lactose intolerant, there wasn't almond milk.
Yeah, it was
no, it was it. So I have a question. Do we get older and then build up an intolerance to dairy, or is it, because that's like I guess we can break a myth.
You can, but I don't really think that the inverse is also true. Many kids, when they were born, had problems with whey protein. It's the protein in the milk that they had, quote, allergies to. So whey or casein, and usually it's the whey, W-H-E-Y. So those kids were considered milk intolerant and were put on soy formulas, and then in really rare cases put on goat. But there was kids back in our parents' days that they had that too. Just nobody said, oh, you're allergic to milk. You can only have soy. So those kids kind of overgrew or outgrew that sensitivity, kind of like with allergies. If you drink something in or take an allergy shot of that for a while, your system will say, oh, you're not an invader after all. I can tolerate some of you. And it doesn't develop that that antigen antibody complex to it. So then you don't have that. So I think some of these kids are allergic to milk products now when they're young, maybe due to sensitivity. They drink a little bit of it, and they overcome it. Do they get back when they get older? Probably, but also the integrity or quality of their gut is probably not as resilient. So
No.
they don't have the ability to fight.
Now, from your experience, do patients come in and sometimes confuse that and think that they just have a food allergy?
That, or the other thing that they think they have is the old stomach virus. And there's not, or you don't get very many stomach viruses. Probably, I've heard studies say like 1 every 3 years. So all that other stuff you have that is the diarrhea, the vomiting, the cramping stuff, a lot of that, sadly, is poor food handling. So you ate something and all with some bacteria. So you went someplace after having a nice night out and went through Taco Bell and
And that upset your stuff.
so it's poor food handling, and a lot of people don't wipe down in between the chicken and the cutting boards and all those different things.
The cross contaminant.
Yeah.
Oh, that's another topic.
That's how I know.
But
Taco
if
Bell
you
is my
ask
arch
what
rival.
are things that are elements of IBS or that people confuse with IBS, it can be the poor food handling and all. If it's a habitual thing that they do, especially, it can be that they're lactose intolerant, so meaning that you don't have the enzyme to break down lactose. It can also be gluten intolerant or celiac. You don't have the enzyme to break those down.
And there's tests for that though now, right? That you can test if they're allergic to lactose or gluten.
You can, but the test in themselves, it's like with celiac. Yes, we can pluck little pieces of your gut and we can look at it and say, you have celiac disease.
But it's better to keep a food diary.
You can still have celiac or gluten intolerance. You may not have a positive biopsy. And I think intolerance, when we talk about that, you may, in your 20s, tolerate one thing. But as you get older, you may not tolerate that as well. There are people who will tell you, I used to could eat
I can
X.
tell you.
Yeah.
So for instance, for me, I could eat barbecue sauce
You
all
can't
day.
eat barbecue sauce now?
I cannot eat barbecue sauce anymore.
Right.
Barbecue
So,
sauce. If I ever want to go to Papa's or somewhere that has barbecue, I have to make no plans for the rest of the year because I already know. Second you touch the barbecue sauce.
Right. And that's a great example of the reason I think sometimes this is difficult to treat and to gain patient satisfaction with is because this disorder really involves the patient's responsibility and accountability and participation.
what you
If he
can-
decides to eat barbecue sauce, I don't have a magic pill that's going to make it okay for him.
It's one of them things like, you know what you're about to get yourself into. So if you eat it,
Now I want to keep a diary of my food a little bit better.
I know I can't. I don't want to say I can't, but kale will
Just
make my
ruin your
stomach
day.
bloat so bad. It's like painful.
I think me is buttery crackers. Like like the club
Asha's
crackers.
faces.
The club crackers.
It may be more what you put on them.
Tuna.
It's probably the tuna.
You think it's the tuna? Well, because even when I don't eat the tuna, y'all don't like the club little crack. Oh, okay.
Club
I'm just kidding.
crackers.
I do eat the crackers.
Y'all had y'all moment.
That's a
Kale.
bad one. I got kale. It's okay. I could do without kale. I could
Oh, but
really.
them little club
Yeah.
crackers, those are good. I know.
I think kale. I think it's hard to just. I don't want to say hard to digest in general, but that's a tough green.
That.
That's a
a tough
tough
green.
Speaking of grains,
Ooh.
so I know, one of the things you guys want to talk about is pre and probiotics, right?
Yes.
Okay, so I'm going to tell you for one thing, I got a disclaimer on it. Not that I don't give them some, but
Just your disclaimer.
what impact they have and all, and what they don't, and some are better than others. They're not all equal. But let's just make it simple on them. Okay, so prebiotics, when you think about how old people talk about fiber and all, they called it roughage. Kale. Roughage. Okay, so that's what the prebiotics in one part is. One part of it, it's actually, I think it's pro. Pro is the roughage. It's going through and it's stripping it. That's where actually there's cardiac benefits from fiber. Okay. When you look at oatmeal and it has that little red heart, it says, oh, this is healthy for you. That's because it's got the roughage.
Okay.
And also that helps decrease cholesterol, which decreases your heart risk. And then the pre is the part where things like kimchi, yogurt, fermented, and say the other word, the K.
Kombucha.
That one, which is a fermented tea.
Yes.
But the other part of the fermented things, I kind of have you need to be careful and know what you're doing if you're going to ferment your own. That's a real risk. Now, the
Kombucha.
That one really is very close to a vinegar with maybe a little bit of alcohol in the time that it gets through. It turns to acetic acid, which is what vinegar is. So the mother's vinegar that year that people all want to drink their little thing of, not much different than that. And then the other thing on the kombucha is that it does have a small amount often of alcohol, just a relative little bitty bit.
Y'all getting
So is it
drunk
good
off
for
of
you?
kombucha?
What y'all look at? I mean, I do drink my fridge is stocked regularly. Regularly.
Some people brew their own. Some people buy it. It needs to, and you have to put the sugar in it to
Make it
has
sweeter.
it has something to live off of. That's what the bacteria is eating. He wants to eat too, so he ferments. So
I just
we're talking
recently.
Spanish, a foreign language at this point.
I'm gonna show you off
It's
camera.
tea. It's
I
fermented.
recently saw
I've seen the teas,
how they make it though. Like people on TikTok have been making their own.
and you're turned off.
Girl.
So what is it supposed to do for you though?
it's a pre. It's a fermented, so it's
a
like a
prebiotic.
kimchi would. It's like a yogurt is. So it's got that good bacteria in it.
Okay.
That's supposed to help encourage further good growth.
Bacteria to grow.
So
And now-
sometimes you'll see it'll say like kombucha, or you'll see it says like sparkling prebiotic drink. Mm-hmm. And so
It was
Like
supposed to just help and encourage good growth.
So, like for instance, like I know if I ever wanted to do like a biotic, I like the little Activa.
yogurt.
Oh yeah,
Yogurt.
Sean put me on those
Yeah.
too.
And for people who can, once again, tolerate those, because that would go in your food diary. And some people aren't going to be able to tolerate those. And when you do the alive yogurt, it's a good one. And you got to look at how many CFUs it has. That's kind of the way they measure those colony forming units. So, and that's the colony of the bacteria that's in it.
So I know you mentioned fiber though, and fiber being that's important in your diet.
25 to 30, and it kind of splits on soluble and insoluble.
Yes.
And that
Come on,
that
Aja.
right,
I
that
was just smiling.
insoluble is going to be what? Roughage.
Okay.
It's going to drag through there and sweep and clean. Now, there's a little issue sometimes with people who have one of those other disorders and all, that diverticulitis, which y'all probably at your age, you don't see it as much in younger people. You see it more in older people because their diets didn't have as much fiber then. So it's like little pockets in the intestine. And if you eat things like popcorn, say, one of those kernels gets in there, then every time the stool rubs past it, and you get a little nerve activation, and it hurts. So that's what you hear people that go to the hospital and end up with diverticulosis.
So what are some fiber-rich foods though? I know oatmeal. I got
Grains,
grains.
leafy vegetables, green.
And you need 25 to 30 grams a day.
I do.
Oh, I'm not doing that.
I am. Here's
I'm
a
not
couple
doing
of,
good.
Well,
I think I
here's-
do it. You like avocado?
Or even the fiber bars.
I do like avocado.
Yeah.
Avocado has fiber.
It has.
Yeah.
It does.
Avocado will clean you out.
And onions. But here's
I like onions.
here's a couple of things I think is the things that you see on TikTok and the making of the tea thing. Be very careful with some of that because
I'm never making that.
Yeah. If you're not
Count
a
me out.
chemist and an expert, that's probably not something you want to get into.
I don't want to grow bacteria. I'm not into growing bacteria. I'm not making anything like
right.
that.
No.
Like
Right.
So if you're not getting 25 to 30 grams, do you need to take a fiber supplement? Would you recommend that or?
I'm always, it is better to eat good, whole, unprocessed foods than to take a little sugary tablet that says it's X amount of fiber and chew it and get the yuck in your teeth and hope it works for you. No. Why not just eat whole grain piece of toast?
with some avocado.
I
With some
love
avocado.
avocado though. Avocado toast.
Yeah. So, I mean, it's always better to get it that way than in a processed pill formula, and especially gummies and stuff. But
So fiber is meant to clean you out. Is that something you should be in, like?
I'll say clean it out.
Yeah,
That's so funny.
So fiber. I'm into this now. So fiber is meant to clean you out. Would you want to eat a lot of fiber if you have IBS?
yeah, because remember, the reason you got IBS is because here's this little gut. Think of it kind of like a sponge there, and it's doing fine, and then all of a sudden, a whole bunch of water hits it. It's got to go somewhere. but that's the same. But if it has the
Diagram is so
fiber,
funny.
The facts.
Right,
I love
there's the
that.
facts. Come on,
Right.
show with the facts.
So then, if you have the fiber, though, the fiber can bound to it and help it to solidify and
Yeah.
form bulk. It's a bulk forming agent.
Okay.
Bulk. Think bulk.
Sean, how much
Yeah.
fiber are you getting a day?
Enough.
And there
Lynn
used
can
to
tell you
But you know
on
what?
Thursday.
Fiber is just important in general, though. Like, you
Right.
want to be going, you know?
Right, you want to go at least once a day.
and there are some better types, and once
Once,
again
huh?
too,
How often are you going, Sean? I'm sorry.
it's about tolerance.
Tolerance.
You know, because like some people, there used to be this little stuff. Well, there was Pearl-Seal Huff, and there's Benefiber and other brands, and I'm not getting into brands, but the bird seed stuff. So, you know, people took it, and it's always something that's kind of going to swell up and bulk up that stool. But people, Metamucil, whichever, will tell you that one works well for them and one don't. And that's what you have to do. This is not a process where the answer is right there in one pill and you've got it. Will have to find the foods that work for you and the foods that don't. You will have to find the fiber that works for you. I will say on the pre and probiotic thing, at first there was a period where we went through and we scammed everybody and told them take them all the time. Sometimes, you know, if you are taking one and say you develop a urinary tract infection, be sure and let your doctor know and ask him if you should continue it or you should not. Some don't want you to continue pre or pro while they're giving you antibiotics.
Yeah.
And some do. And then,
Rachel just stressed. She like, okay.
Because I'm the complete opposite. I don't use the restroom often.
Oh. Lynn can tell you on a
I'm
Thursday.
so sorry for you.
No, it's like rare. Like I can go at least a week.
Oh, no.
You need more fiber. You need more roughage.
Yeah, that's what I'm saying.
so,
No.
so you're just storing the toxins.
That's why fiber is important. Think about it. You
I
wanna-
eat a lot.
Well,
you need it to
I eat
get
oatmeal.
out.
I eat everything. I eat healthy foods. I eat a
Fiber
salad.
and water are the big contributors to it. And I think you drink a
I drink. That's all I drink is water. Actually, people don't like coming to my house because all it is water. It's water and wine. That's it. That's
Okay.
it.
Is it more wine than water?
Nope,
Again,
it's more
just-
water than wine.
Yeah.
So yeah,
I feel bad for you. I'm sorry.
Do you
That's
eat-
uncomfortable. That is uncomfortable.
but I
like-
don't be uncomfortable. I'm not
I
uncomfortable.
think you're so used to it because for me personally,
Mm-hmm.
I remember like one time I I went into the provider's office and I was like, hey, I need some help.
Yeah,
I
something
did
ain't right.
not. I did not go, and they were like, "It's been a day." That's a lot for me. Like no.
Yeah.
No, I did pay attention at a point in time and got make sure I was getting everything I needed and I was going more regularly. And then even keeping it up, it just stopped. I guess my body got used to
I would
it.
say most people have a bowel pattern that they know, like hers, every day. And every day is healthy for her. And if she doesn't go then she probably starts to bloat and feel miserable.
Yes.
And right.
I mean.
And other people, I would say, if you said, well, how often do you have to go? Okay. I don't know that there's an exact per se, but if you don't go every 2 to 3, if it's a break in your pattern, that's probably a concern. But people should be going probably at least every 2 to 3 days. More than that is a concern. And now I will say another thing too. So
I need to get my gut
right
checked.
now, we're all talking out there about the Ozempics, the Mounjaros, and those. Mm-hmm. They are not IBS creators, but some people will feel like they have IBS on those. So a lot of times the medications you take are what may be causing IBS. One time I was taking, it was Walgreens or some stores, brand of Zantac. Mm-hmm. And I noticed I started
What
having
does
these.
Zantac do?
That's
It's
like-
for your stomach, for burn, for heartburn.
Oh, okay.
And I noticed I suddenly started having diarrhea stuff I hadn't had before. And honest to God, it was that pill. As soon as I stopped it, that went away.
Fine.
So if you notice in that food diary that you start a new medicine or a new supplement, or even these medicines, the GLPs, you will have that type of stuff. You will have nausea. You will have bloating. You may have some diarrhea or constipation.
Now,
Go ahead.
I was gonna say, so when it comes to pills and injections, stuff over the counters, what do you think about laxatives?
Never.
No go.
No go. You can use stool softeners. You can.
Well, we both like.
You can do the old 2 prunes or heat up 2 ounces of prune juice and drink that. That will do all that you need to do. The thing about laxatives is the body's real smart. So it's like if it sees a pill is going to do it or a machine is going to do something, it says, hey, I'm busy. I got a lot of stuff to do. I don't need to regulate that bowel thing because girl's taking a laxative every day.
Oh, that's a good
So
way to
then
put
when
that.
when you stop taking the laxative, you don't start back because the body says, I didn't have to do that. I've been offline for that. She's been taking care of that.
Get somebody else to do it.
That's right. So it will take you a great deal of time before you will be able to start back. And that's the part that if you read on the little print on the back of the laxative box, it talks about dependency and about how bad they are. So laxatives are not good.
I pretty much don't think anybody just looks at the small print on
I
the
do,
back.
I was like, I've
Right.
never seen that on the bottom. And I've taken them just like, especially for like vacation, and I need to get that bloating off me. I'm gonna take one.
Well, right. So the better way to do would be to use some of those natural remedies that do work. Because once again,
Prune juice.
okay, what did I just tell you? It has a lot of sugar, and if you hit the gut with a lot of sugar or fat real quick that's not used to, what happens?
You gonna... It is the sound effect. But I mean, that's really
What happens though? That's what happens.
But that's what happens. You will hear it too.
I'm trying to figure out what I guess increase my fiber, drink more water, but I feel like I do all those things.
Where's my roughage?
well, then the next
Where's my
thing,
what?
Roughage.
right,
So
and exercise.
I exercise quite frequently.
You do so.
Yeah, that's why people are.
I'm sorry. This
Yeah, that's why people are actually quite surprised when I tell them that because I work out a lot.
you're
I drink a lot of
special.
water. I don't want to be this special. Sean.
See if raisins will maybe work. I mean, there are some, some people can't drink fruit juices anyway. I don't really recommend them anyway because of the diabetes and sugar. But in someone's case like yours, maybe you need 4 ounces of orange juice a day or something. Maybe it's apple juice.
That's my thing. I can't have no orange juice.
Apple juice is the one. Apple juice will get you right on together.
Which and
Apple juice don't do nothing to me.
see, and there's the perfect example. For one, does it. For another, it doesn't.
Boy, apple juice gets you right on.
Nothing. It does nothing to me.
So yeah.
Wow. I'm just trying to think. Only thing I could think that just don't do me good is kale.
Oh, mine is pretty much sauces. A lot of except like ketchup and mayo.
But
if it's
they
not
often-
ketchup and mayo, most sauces send me through the roof.
But they
you know,
often
ketchup
have
is
sugar.
barbecue.
No, well, the first ingredient in my favorite ketchup is the high fructose corn syrup. In another brand, it's tomato. So just remember, these sauces are highly processed, and they have a lot of sugar usually in them.
I'm just reconsidering. I
You
need a
know
food
what? I'm not
diet.
even going to talk about. Every time we do an episode about food, I just be like, oh, here we go.
Like, I can't do
gotta
nothing.
change. I gotta change my lifestyle
Yeah.
again.
I can't do nothing. But if you are struggling with this, these are like good points, like because there's no treatment, just a better diet.
Yeah. The treatment for this is that you need to make changes in your diet and see what's causing the symptoms and the response, and then take that out. There for IBS, which is different, just always remember it's easy to get IBD and Crohn's. They are totally different than this disorder. IBS is about what you're eating and your gut's response to it. And so there needs to be some changes there.
Now, when it comes to IBS and Crohn's, could
You can't say
could
those,
it be mistaken for another condition such as like inflammatory bowel disease or like colon cancer? Or
Yeah, and so when you look at these two, the cousins would be IBD and Crohn's. Okay, they're an inflammatory disorder of the immune system and it's very bad. I mean, it's a serious disorder. You can end up with resections and stuff like that. And those people live a very uncomfortable life. And the treatments for there, and we do have some now that are successful, they're very expensive. And yes, you'll never really see anybody that if you have this very often or having problems and we don't have a colonoscopy on file, doesn't want one. Okay, I do want to know that it's not cancer first. I do want to know that what you're telling me is all there is, but that it's not IBD or Crohn's.
so that would be one of the early screening processes, recommending a colonoscopy.
Yeah, go visualize and look and see if there's thickening of the mucosa inside the gut. That's the IBD often, and Crohn's may have some of that, but the most serious one I think is the ulcerative Crohn's, which is where it just kind of tears and stretches and starts to bleed and leak, and you have to resection there. and all. And
That sounds
those,
painful.
Yeah, that sounds
Yeah.
very
I know.
painful.
I'm like, oh my goodness.
Crohn's is painful though. That's right. Yeah.
it's very painful. It's a very debilitating and in a daily life type thing like that. But they do have flares. The other side of that is we have medicines for that now that we could only have dreamed of, 10, 15 years ago. So that's good. So those are the things we want to make sure of first. And when you get into it, it could be a secondary cancer and stuff. But I will say the other thing that's kind of controversial now is the leaky gut syndrome.
She's in my head. Because that was about to be my question. I'm like, I've heard
Yeah.
about leaky gut, but
What is that?
I have no clue. That's why I was about to ask
I
you.
like the bubble gum.
And I don't want to offend anyone when I say this because people, when they attach a label to a disorder that they have, they fall for it. They fall in love with it. And maybe they went to a alternative medicine or integrative medicine doctor who told them this is what they have. It's been the source of their problems all their life. This is why you are the way you are. And that leaky gut is not...
Well, first, what is leaky gut?
Well, it says that, and it is true,
I love it.
that the gut is permeable. Okay, I just told you things can go in and out.
Yeah.
It's a transport area.
Okay.
Okay, it's a transport. Things go in and out. And under this leaky gut syndrome hypothesis, which is what it's called, the thought is that probably toxins go out into there and leak out and get into the bloodstream and make you feel... So if I said that I often have some gut stuff and then I feel fatigue and maybe it makes my depression worse,
me.
yeah. Some people might say that I have leaky gut, but
How do you fix leaky gut?
The way you say it.
This is real. No, I'm just kidding.
Well, I want to advise you to be very careful because often those same doctors that tell you they have that in that realm have a shelf full of products that will help you
nice
to fix
little
it.
yeah.
And you can go to any natural thing. You could probably go to some of the vitamin shops here in town. You can go to Amazon. You can spend thousands of dollars.
I don't think I have it no more.
Pills, liquids, all that to take care of this leaky gut deal. So, I'm more straight medicine, and science, and I want to see studies and I want to see data because I've watched over my life these things come through and we thought they were real or something had more science to them than they had. And then we found they didn't. And I look back at the amount of money you can spend on something like this. So if you have a problem with your stomach that is causing that degree of discomfort, pain, bloating, diarrhea problems, then we can probably correlate it to an organic, physiological, and physical change. Now, can a person have severe anxiety disorder and, this triggers their IBS and stuff like that? I can. But, I'm not going to say
Because I was just about to say, like, what if you're eating all the right things and everything is great, but only when, like, you're about to go on stage or or, like, things like that. So, like, it could be, it's not really data on being stress-related, but it just can induce it, I guess it sounds like.
Yeah, there's studies that are beginning to look at that and all. You have a sympathetic nervous system and a parasympathetic nervous system. And the gut is a very innervated place. So there's a lot of nerve there. There's other parts of the bodies that doesn't respond to that. But the gut is a very innervated area. So maybe that's why that. And I think
that's me.
Yeah. Even, like I said, abdominal migraines and things like that, people who their representation of their mental status or issue is illustrated via their gut.
So one thing like for me, if I have to DJ somewhere, I will not eat anything outside of like a fried food. Because I know.
Do you get nervous still?
Sometimes, but there's like I always have I think it's a mental thing where I have this risk. Is like if you eat something outside of a fried, like a green, like a roughage, or if you eat
now he about to start saying roughage every time. Oh.
But let me tell
sandwiches, like certain things, sauce. I already know sauces are completely off limits. Even ketchup, like I don't even want to risk it. Like no.
And the irony
Straight
of
French
this is-
fries and chicken
I feel
tenders.
like we had wings the other day though, so you could eat.
No, he said when he has an event.
Like if I have an event that I have
Okay.
to go to, and I know in my mind I don't want to have any kind of issue, I try to avoid most foods.
No, I know for me, mine's if I get super nervous, like y'all know when I gotta go up there and do the birthday anniversary stuff, I'll be up there like sweating, like please just get me off this stage.
So the irony of that is think back to little kids even.
Yeah.
What did we tell them? Do you have butterflies in your stomach?
Yeah,
Oh,
So, sometimes for some people, I think their representation of their anxiety may be through a stomach thing. And we also have another group of things like somatoforms is what we call that one. So, it's true. I mean, I hear people who have those types.
and there's nothing for me, huh?
Sorry, Rachel.
Well, yes, there is. It's called rational and cognitive emotive therapies that help you to learn how to manage your anxiety.
Therapy.
And your
Therapy.
coping.
That's one of the questions. Is that helpful? Therapy.
Right. And that's the thing, because once again, though, that's not a pill that I can give you to fix you.
I got
I'm
to go through a lifetime of
asking-
therapy.
Right. I'm asking the patient to work on their coping and all and this is like he knows the triggers for him and the things he can. And that's what a patient who wants to improve their gut health, who wants to lessen their symptoms from diarrhea, cramping, abdominal pain, needs to do
was personal.
is keep the food diary, find out what it is for them, and eliminate those foods.
Well, we know what to get Sean if he ever upsets us.
I have.
Diapers.
I do have one
Barbecue sauce. I was gonna say barbecue sauce.
One question before we wrap everything up. So I know we talked about just how important the gut is, and you were saying that it's permeable. Do we ever see, or as a physician, do you ever see poor gut health like manifest into other things like acne or hives or just like physical things?
You will see it in skin stuff. I mean, in the sense that, people when they start to have problems with their gut all the time and their anxiety and all, you'll see that. But that's also some hormonal stuff and probably some immune stuff too. Because
Jesus,
some
it's just
people,
everything.
So,
Stay in the house.
I think you'll see it there. Long term, with diarrhea, just imagine you're losing all your electrolytes and your elements and those vitamins and those good things from food.
Right.
So those people, suffer malnutrition and stuff like that. You also suffer a lot of skin discomfort and all around the anus and all that because it gets raw, you get chafing, those types of things. There's a lot of discomfort
Sean's
that comes
face,
with that.
y'all.
Right. And then, how you wear, your pants and all, if you're always feeling bloated, that's an uncomfortable feeling. So clothing can be uncomfortable and all. When you're feeling bloated, yes, burping, belching. I have patients that come and, at first when I was probably newer in practice now, if you came just for burping or belching, I thought you was a weenie. Or but when you realize that, people can be trying to talk to their boss or do a presentation or, be in a romantic situation and wanting to make a positive impact. And instead,
Yeah, you really don't think.
Has that ever happened to you? Like your partner just burp in your face or something?
No,
Me neither. Like I couldn't
like,
even
dang,
imagine. No, I couldn't even. I just.
But no, when you think about it, like because it's just when you when you think about it for real, when you think about situations like that, you may just burp once.
And you just
And,
like,
okay. Or you may have like gas, like
But if you
once
do
every so
a lot.
But I couldn't imagine going through that every day,
constantly.
constant.
and having to turn your head, and then what's wrong with you?
You need to start keeping a diary. Of your
Imagine me
foods.
trying to talk to patients all day and I'm just burping all day. They would probably be
Or
like,
if you have gas, flatulence is not something you can really do well.
You
So
can't
in the
control it.
office, you're going to run out of the office, come back and do this exam. And people are in other social, and so it can create some social anxiety to try to manage the symptoms. But I think the thing with the sudden onset cramping, diarrhea, and all that IBS people go through during times that they're really experiencing it would be very challenging.
I've just learned so much. I'm taken aback.
But the easy thing is, or to wrap up,
I'm going to start a food diary.
Same.
That's my thing.
Keep the food diary. Find out what it is for you there. Eliminate the foods that are a problem for you. And then a balanced diet for most people is enough.
Okay.
That's what's hard. Is there are some people who probably need to take a multivitamin a day. There are some people who probably don't. But if you take a multivitamin a day and eat a balanced diet, all the little colors of the rainbows and all that, and eat your fiber, for most people that's enough. What I see today is people stressing themselves a lot with information that they find out online sometimes or whatever about this newest supplement that they need, and then this supplement, and then that supplement. And if you're taking 3, 4, 5 or more of those in themselves are probably causing some of the gastric irritation you're having.
Because people don't read the back where they be like, please consult your physician.
Don't take this if you have A through Z and they still popping it like her. So I have one last question for me. So like I know people who may have like their gallbladder removed. Does that increases them going to the? But that's different.
It can decrease their tolerance of fat because they don't have the bile any longer to break
that's
down
what
the
it's
fat.
doing. It's
and all
okay,
and
so.
all these things. When you look at the leaky gut, one of the things is the enzymes are coming out of the pancreas. So some people get really concerned about their pancreas because that's where you get the enzymes to break down food. So your ability to break down protein is in response to the enzymes you make called prokinase. And if you've ever seen anybody that's had pancreatitis or pancreatic issues and they have to take a handful of pills before they eat to break down fat and protein.
This was really a biology class.
This was very informative.
I just had started having flashbacks. We talk about permeability and passing through. I'm just like, ooh.
Transport.
Yeah,
transport.
That's by your one.
If nothing else, I know I'm
first week. I'm like, ooh. Yeah. I'm having flashbacks.
Yeah, nothing else. I know I'm getting me a
just remember though, if you decide if you're a person who usually doesn't eat a lot of high sugary stuff or the high fat, and you decide to go have a butter coffee or an MCT oil,
it's gonna hit different.
Oh yeah, don't go too far down the road without knowing where your next stop will be. As you will
plan your stops out.
Yeah,
I love it. Plan your stops out.
Oh, well, this was interesting episode.
Yeah.
I feel like everybody just need to eat their roughage, as Sean is going to remind people.
Eat your roughage.
Eat your roughage.
And Lynn, I just thank you so much because, we're going to continue to ask Lynn.
Yeah.
Anytime we have an episode.
What would Lynn say?
Is Lynn available?
Yeah. Let's call Lynn real quick and ask.
I'll be glad to. I enjoy it.
Thank you, Lynn.
Thank you, guys.
Me too. Well, is there anything else that you would want to tell our listeners? Anything you just feel like, hey?
Well, I think there's a couple of things that should be red flags for you. So if you're having bloody diarrhea, and don't think that that's because you drank milk or ice cream last night. You need to go follow up with your PCP. If you're having a lot of pain and stool blockage type stuff, or you have a history of colon cancer in your family, especially a familial ones, then if you start to have any of those types of symptoms we've discussed, don't try to diagnose yourself. Don't try to play Dr. Google, all that. Go see your PCP and discuss those things. And also, then you can work out a plan with your PCP or a GI doc and do that food diary and see what things you need to eliminate or not. But that's not always applicable, and that's not the cause for all problems. So a lot of these other problems can be things that are very serious and need a physician's assistance.
Oh, yes. Okay, and as that, I'm going to just do a brief disclaimer because this was a serious episode. While we do thank you guys for tuning in, this is not a substitute for medical advice.
Right.
So, if you do find yourself having any issues, come see us. Give us a call at 713-778-1300 or use the chat feature on our website at offeringhope.org.
And always remember, here at St. Hope Healthcare, you're more than just a number.
Thank you.
Amen.